What is the current medical opinion on biopsy of small kidney tumours? The increased use of medical scans has led to more detection of incidental findings, including small kidney tumours less than 4 centimetres in size. Not all of these tumours are a cancer. As many as 3 out of 10 will not be a cancer and will be benign. These do not require treatment. Currently, without having surgery, the only way to tell if a kidney tumour is a cancer is to have a biopsy. This is performed by a radiologist who uses a needle to take a sample of the tumour under local anaesthetic and guidance of an ultrasound or CT scan. This sample is then looked at under a microscope by a pathologist to see whether it is a cancer or a benign tumour. Following the biopsy, most patients experience some bruising and discomfort, but complications are rare. Currently, there are no guidelines on the use of biopsy, so patients may or may not be offered a biopsy depending on their urologist and hospital. The NIHR funded a project to look at the perception on facilitators and barriers to the use of biopsy, and the Urology Foundation has funded a project which brings together patients, urologists, pathologists and radiologists across Europe to produce a consensus statement to provide advice on when a biopsy should be used and how a biopsy would be useful in the management of small kidney tumours. This consensus statement has 2 main categories. The first category relates to when a biopsy should be offered. 1. A biopsy should be offered before the patient has any treatment, including surveillance. 2. Patients whose tumours are mainly cystic should not be offered a biopsy because it has a higher likelihood of being unsuccessful. 3. If the first attempt at biopsy is unsuccessful, then a second attempt should be offered. 4. A biopsy should be available to all suitable patients. 5. A biopsy should be offered to patients on surveillance if changes to the tumour are identified on repeat scans. The second category explains the evidence that is still needed to improve guidance biopsy use for patients and clinicians. 1. Evidence showing that having a biopsy can change a patient's choice of treatment between surgery and less invasive treatments like ablation or surveillance. 2. Evidence showing that a biopsy reduces the number of patients having surgery for benign tumours. 3. Evidence showing that a biopsy is an effective use of limited healthcare resources. 4. Evidence showing that a patient's quality of life is improved through having a biopsy. In addition, it was felt that more research was needed into how having a biopsy affects patient anxiety and to increase the success rate of a biopsy. This study is funded by the Urology Foundation and the NIHR, Research for Patient Benefit, NIHR 200-536. The views expressed are those of the author and not necessarily those of the NIHR or the Department of Health and Social Care.